Breastfeeding. So, why is it important to nurses? As registered nurses, it is our responsibility to competently provide holistic care to new mothers within our own individual scopes of practice. So let's imagine this scenario. You are a registered nurse conducting a home visit for a 28-year-old new mom, 3 weeks postpartum, with breastfeeding difficulties, specifically latching. Firstly, it's essential to assess the client by using CFAM. A method like an eco map also allows nurses to assess client support systems and sources of stress. For this scenario, the new mom shows a strong relationship with both of her parents who continuously support her, whereas she shows a stressed relationship with her husband due to his busy work life. An eco map also assesses the relationship of the client to other subsystems such as finances, friends, work, and religion. Once a nurse has gathered all the assessments from their client using CFAM, they're able to implement appropriate interventions using CFIM. For our scenario, an example of a cognitive intervention would be educating the mom about the benefits of breastfeeding, whereas an effective intervention would be to empathize and acknowledge the mother's frustrations. Finally, a behavioral intervention would be encouraging the mom to keep a record of the duration and quality of breastfeeding each day.
Now, going back to our scenario, the new mom expressed concerns regarding latching. There are 5 main factors to assess the quality of breastfeeding. First, being the quality of the baby's latch. Secondly, the type of audible swallowing heard from the baby. Third, the mother's type of nipple, such as everted or inverted. Fourth, the level of comfort for the mother and the baby. And finally, the position of the baby's being held in. For a good latch, the first step is to line up the baby's nose on target with the mother's nipple. The second step is to tickle the baby's lower lip with the mother's nipple. The third step is to wait for the baby's mouth to be wide open in order to latch. The fourth and final step is to move the baby's head onto the nipple to make sure the lips are flanged and the chin is tucked. Another way to ensure quality breastfeeding is to assess the baby's audible swallowing pattern. At the beginning of a feed, the baby's swallow and suck pattern should be short with rapid sucks. In the middle, also known as active feeding, the baby should have long, slow, rhythmic sucking and swallowing with pauses. At the end of the feed, the baby should have what's known as flutter sucking with occasional swallows. The baby's position, also known as hold, is important for effective feeding. There are 4 common positions that mothers usually feel most comfortable using. Across the lap is a good position for moms with small newborns as it gives you lots of control. The cradle hold is good for babies that are a little older and have started gaining control of their necks. The football hold is suggested for moms that have had a C-section. Finally, the lying down position is the most comfortable for moms that are feeding frequently. For the mom in our scenario, the across the lap and lying down positions may be the most effective. However, always allow the mom to choose the most comfortable position for herself. Always confirm that the mom understands your health teaching and is able to perform the activities on her own properly. Get the mom to demonstrate the techniques until she feels comfortable, and make sure to support and commend her in the process. This is a good time to use her family as additional support.
An additional piece of education that new moms should know is how to tell if their baby is getting enough milk. Here's a useful list that moms should know. As a baby grows and develops, so does the size of its stomach. Make sure moms know how much milk their baby should be consuming based on their developmental stage. A well-fed baby should wet 6 to 8 diapers and have at least 3 loose stools per day. A baby's weight should double by the end of their first year of life. Most importantly, a registered nurse must be able to empathize and understand her clients, build a therapeutic relationship with the moms and the family, and take advantage of her support systems throughout her breastfeeding journey and provide new ones. Thank you everyone for watching our video.